Certainly, I think it's a very important session from our point of view as we continue to benefit from the contributions of PAHO in the region and to try to focus those contributions both from a PAHO point of view and from our utilization in Barbados and in the Caribbean. What's going on now, of course, is the COSHOD, and which again seeks to consolidate the CARICOM position with respect to a number of these issues, which are largely wide-ranging and usually specific to the area, common to the area. But universal health coverage is clearly the opportunity to ensure that there's quality health care available to all. Of course, it broadens to include not only the residents of the country for which you have responsibility, but for indeed visitors and people who come to work in your country. So universal health coverage is a very wide-ranging topic. Health coverage, health care is expensive and is increasingly expensive, especially as we've come to the stage where we save lives. We provide very special health care in many, many areas. And this is what is facing our countries, is facing our small countries in the Caribbean, is facing the United States today. I mean, the argument all weekend has been the question of the Obamacare issue. And it relates to the same issue at the end of the day. How do we pay for this very expensive commodity which we believe so strongly is the right of everyone? I think one of the best ways that the Pan American Health Organization can improve the delivery of its service at the country level is the increasing the use of technology and not necessarily depending on the movement of people from your headquarters here or anywhere else to our regions. We already have in many of the islands offices and coverage by specialists from PAHO. I think, though, that with the kind of technology available now, we need to apply this by way of website connections, information, data collection. One of the very, very critical areas, I think, is strengthening of our data collection in the Caribbean. And when you move around the private sector here in the United States, the kind of information that is available in your country about what happens in the United States of America, and indeed globally, it is stunning. And we really have got to get to the stage where our data is captured and available for good analysis, so as to direct the way in which we apply our resources, and that way save our precious resources and make sure they get to the more specific and needy areas as the need arises.